Welcome
Good
you
morning.
for the third session of the wildlife disease investigation webinar series that we are doing. And I am Daniel from Life Trust India. We are into wildlife conservation promoting activities involving community in India and other regions also. As I mentioned, this is the third session, and all the sessions will be recorded. The recordings of the previous sessions will be available through YouTube. We'll be sending the links of the previous presentation and also the current presentation maybe in a couple of days. Okay. If you have any questions for the presenter, you are most welcome to post your questions on the text box, and then all the questions will be answered at the end of the presentation. Okay, with this, the certificate of participation will be issued to all the participants at the end of the series. So we have 3 more sessions to go. And so that's the thing. So now I request Heidi to just introduce the presenters, and over to Heidi now.
Thank you, Daniel. First of all, I would like to welcome everyone on behalf of Asian Elephant Support, who is one of the partners in this series of webinars. And we hope that you not only enjoy the webinars, but learn something from them. And we also encourage you to ask questions and to keep in touch with our presenters over this year and the number of webinars that we will be doing on various topics having to do with wildlife disease investigation. So this webinar is primarily about elephant health. Our first presenter is Dr. Christopher Stremme. Dr. Stremme is a veterinarian and a former elephant handler and trainer with over 25 years of experience in elephant healthcare and management. For the last 20 years, Dr. Stremme has been involved in various captive and wild elephant welfare and conservation projects in several Asian elephant range countries. Since 2004, he is living in Sumatra, Indonesia, where he has developed and managed elephant healthcare programs with local NGOs, providing regular healthcare and management assistance for captive and wild elephants throughout Sumatra. In 2015, he joined the veterinary faculty at the Syiah Kuala University in Banda Aceh as an associate lecturer to lead the development of elephant and other wildlife veterinary training and teaching programs, as well as the development of a wildlife ambulance. Since 2016, Dr. Stremme is the program manager for the organization Community for Sumatran Nature Conservation, working on elephant conservation programs in the Way Kambas National Park. Today, Dr. Stremme's presentation is about some healthcare aspects in Sumatran elephants, Elephas maximus sumatranus. So, Dr. Stremme, over to you.
Thank you very much. Thank you for the introduction, Heidi. And I think with no further ado, I try to share my screen. Let's see if that is working. And so, is my screen shared with the first slide?
No.
Huh? No?
Not yet.
Shit,
Not yet.
I don't know what I did wrong. I clicked on share screen. I click on share screen, then still not shared.
Yes, now there we go.
There you go, okay.
Now we can see it. So you can, if you start the presentation at the first slide, then, yep, there we go.
Now we're full screen. Okay, thank you very much. Welcome everybody. I'm working with the veterinary faculty at the Syiah Kuala University, where we have wildlife ambulance through which we are involved in the regular veterinary care for a captive elephant population of about 100 elephants in different locations. And the major part of the healthcare is actually preventative healthcare. Only maybe 10% of our activities with the captive elephants is actually curative care. Mostly it is preventative schemes, which I want to mention the most important. So regular health checks, training the elephants for medical procedures, foot care, antiparasitic scheme, and tetanus vaccinations. For the regular healthcare, it is important that we are not only come to the elephants if they are actually sick, but we regular every 3 months visit each of the places and do general health checks in each of the elephants, like doing a body condition score, weighing the elephants, measuring the elephants, once yearly taking also a blood sample and doing a basic clinical examination that gives us an overview and helps us to be ahead of any problems or anticipate any problems that may occur. To be able to do that, for us, it's very important that the elephants properly cooperate, and they only do that if the elephants are trained for that. So when I started to work in Sumatra, most of the elephants were not really specifically trained for veterinary procedures, and sometimes it was very difficult to approach the elephants for any kind of treatments or examinations. So part of our regular work with the mahouts is to encourage the mahouts, to guide the mahouts, to train the elephants, specifically also for different kind of veterinary needs, of care needs. Like one is, for example, having the elephants trained to being in a restrained shoot. So the elephants can be restrained. They're used to that. They're not stressed when they're restrained. Either they're on chains or they're in a restrained shoot. The elephants know that and easily accept that. That makes it a lot easier, alongside with training the elephants to be adapted to get touched and examined at all parts of their bodies, whether it's the ventral abdomen, whether it's between the leg, around the eyes, whether it's on the feet, or also being able to manipulate the trunk, touch the trunk, doing examinations, any parts of the body. Also training the elephants for accepting and knowing that samples are taken, like blood samples, are taken without being the elephant stressed. And for example, also doing oral examinations of the mouth cavity. And especially for captive-born calves and for rescued orphans, we very much encourage and guide the process to start the training very, very early with the basic training needs. At an age of 3 to 4 months, the basic training is started with these young elephants, which is a lot easier and a lot less stress, and adapts these procedures at a very early age. One part, as I said, is regular foot care. So why is foot care sometimes needed in captive elephants and not in the wild? Well, in the wild, elephants are active for 15 up to 18 hours, sometimes even more, walking around looking for food, migrating in the habitat. In captivity, elephants are active usually a lot less, or mostly a lot less, which can lead to the fact that foot pad and toenail, which are permanently growing, overgrow, and the anatomy and the function of an elephant's foot is quite different to a horse. So the weight is distributed over the entire foot pad through this digital cushion made from collagen fiber and connective tissue. And in the opposite to a horse, which walks on the tiptoe, the weight of an elephant is distributed over the large foot pad, and only very little, if none, weight is going on the toenail, which is actually a much smaller and a less stiff and rigid structure compared to horses. If due to lack of exercise, this is starting to overgrow a lot, when the elephant is walking, a lot more weight is bearing on the toenail, abnormal weight, and that can lead to cracks in the toenail. You can see here a very intensively overgrown and cracked toenail, and these toenails can split through the nails and can actually cause splitting into the sensitive issue, causing literally open wounds, can also get infected. Overgrowing toenails also can enclose the space between the toenails. Usually there should be an open space between the toenails, so the toenails, when the elephant's walking on the foot, is flexible. If that is not the case, so the toenails meet in the middle and they can break, and also can cause create cavities and holes which entrap dirt and foreign bodies, which can lead to destruction of the lower tissue or deeper tissue. The same can happen with a footpad. Footpads also can develop excessively if the elephants are not walking enough, and developing double layers, which in between double layers also some dirt, some foreign bodies can be trapped. Just try to look here, like here, and that can lead to destruction of the footbed. This is why we when we're visiting, we're doing foot care together with the mahouts. We also encourage them to do the mahouts by themselves on a regular basis to prevent these problems, because once you have something starting, you'll see here 2 pictures from the same toenail, 2 years apart from each other. Yeah. And nothing has been done, no interference has been done, no trimming has been done, and the crack has cracked through up to the top and has caused a wound on the foot, an infected wound on the foot. Also, these bad cracked nails can be treated, but it takes a long time. Here's an example: completely split through nail, cut apart in 2 halves. After the initial trimming, that is what it was looking like. Yeah, you can see the crack went deep inside, into the vascularized area, and this is not done with one intervention. So in a several months or weeks intervals regular, you have to retrim that to ensure the toenail is kept short and no weight is bearing on the toenail, and then the toenail starts regrowing from up from the top to the bottom. And after a period of more than a year with regular retrimming, the toenail is healed, and this is the condition. Can you see my cursor here? Is that visible on the screen?
Yes, Christopher, we can.
Yeah. So you can see that is after the last trimming, after over a year. So this is completely healed, but it takes a long time. So it's better to prevent that by doing regular foot care. Another problem with feet that we have experienced several times in Sumatra is complete or partial destruction of the footbed in situations where elephants kept for a long time in dirty places, muddy places, wet places. In these places, a lot of bacteria develop, which are very aggressive and can destroy the footbed. If you can see on this picture here, only the heel is destructed, but also larger parts of the footbed get destroyed if the elephants are forced to stay for a long time in dirty, muddy, polluted and wet places. Yeah, and this is after the first start of treatment, trimming down on the foot. Only a part of the footbed is left, and the problem here is often that the tissue, the affected tissue, is granulating but doesn't perform proper epithelialization. So if that is not properly treated, these wounds are not really closing, and I have seen several elephants that died from this problem due to septicemia finally. And very often we can experience, or have experienced at least in the past, this problem in male elephants during the must, when they're not can be properly handled, safely handled, and they're chained up in one place and they're kept permanently in this place. In addition to that, it is if it is raining season, the situation becomes even worse, and very often these problems occur. So that is something we also have to pay attention as vets to try to interfere early enough. Another important part of our preventative schemes is regular anti-parasitic treatments. Why do we need to do that? I mean, also wild elephants have parasites, but normally and relatively low or medium loads, which does not cause any clinical problems. But in captivity, elephants are restricted to smaller spaces where infestation with worm eggs are a lot faster, a lot more often, which can cause high infestations with gastrointestinal parasites, which can lead to severe sickness and the worst case, even death. Therefore, also every 3 to 4 months, all of our elephants are regularly treated with different kinds of drugs in accordance with the worm species that we identify. So if you don't do that, you can end up with elephants which show these symptoms like weight loss, ventral edema in this massive ventral edema, loss of appetite, lethargy, diarrhea, sometimes even constipation from high worm loads. And in the blood analysis, we usually will find anemia, hypoproteinemia, and eosinophilia. Well, of course, these are symptoms that you also can see with other diseases. Finally, diagnosed, of course, is from the feces. Either you find the adult worms in the feces, then the infestations are very high, or you do a fecal examination with a microscope to identify not only that you have worms through the worm eggs, but also what species you have. So different kind of Strongyloides, Strongylus species, different kind of trematodes. Trematodes can be found in elephants as well as cestodes. In Sumatra, the most often that we have different Strongylus, Strongyloides, and gastrointestinal trematodes from the group of the Amphistomum. Rarely we find fasciolosis in Sumatra. Very rarely we find cestodes, the anoplocephala, and personally, schistosoma have been reported in elephants from other areas in Asia, but I haven't seen it in Sumatran elephants. For us, a big issue in Sumatra very often is the amphistomum, and amphistomiasis is caused by different amphistomum species, gastrodiscus, pseudodiscus, Pfanderius, so different genera of amphistomum can occur. And these are pictures from a postmortem that actually died over after a long time of infection. And this is the pictures of the postmortem. The entire gastrointestinal wall of the large intestine is completely covered with these worms. Yeah. So to prevent these diseases from high worm infestation, we use different kinds of drugs in the rolling rolling scheme. We use different kinds of benzimidazoles, which mainly affect the nematoda. Some, like albendazole, also affect trematoda. We use the ivermectin, which is very effective against a large number of nematoda, as well as ectoparasites like Hematomyces elephantis. You can use it, or we use it sometimes orally, sometimes rectally, but also via injection, just to reach proper blood levels. If we use it oral or rectal, the dosage is higher than compared with the parenteral intramuscular injection. Yeah. The salicin analytes, we use closantel, which affects nematoda and also would affect fasciola. But the only one that affects, in our experience, where we had sufficient effect against amphistomum, the amphistomum species that we find in Sumatran elephants, was the drug oxyclosanide. Yeah, it also affects some nematoda and fasciola, but important for us is here that we have a drug that affects sufficiently the amphistomiasis, which is not done by closantel and is not done by any of the benzimidazoles we use. So these are the regular range of different dewormers that we use in a rolling scheme. We have also used a few others, like the benzimidazole triclabendazole, which is the choice of drug for fasciolosis because it affects all larvae from the fasciola, not only the adult, but it's effective only against fasciola. Praziquantel we have used, which is probably choice of drug for schistosoma and cestoda. As I said, schistosoma we have not find, but cestoda sometimes we find. And the imidazole levamisole is probably a choice of drugs for cutaneous filariosis. However, it also affects nematoda. The critical thing where I want to mention with levamisole, it has a very narrow safety margin. So only overdosing 1.5 times will cause very severe side effects, and only double the normal dose can, in the worst case, also kill the elephant. So I won't only recommend to use levamisole if you can do a very proper dose calculation, have a very accurate weight of your elephant. Finally, tetanus vaccination is one of the preventative schemes. Why do we do that? Well, tetanus is caused by Clostridium tetani, an anaerobe, obligate anaerobe bacterium, which cannot survive without the presence of oxygen, and is very heat sensitive. But it does produce spores, which you can see in the microscope, and these spores are very hardened, survive very long in the environment, and are more or less available everywhere in the soil. And if these spores, through, for example, a stepping wound with a foreign body, get inoculated into the body in a wound, deep in the wound where there's no oxygen, then the vegetative form starts to develop and it starts to produce toxin. And this toxin interferes with the neuronal signal transmission, which is causing spasm and muscular cramps, which mostly is leading to death. Well, tetanus infection is treatable, but in our experience, only if you start very early, when you catch the very early signs, which is usually lockjaw, so the throat of the elephant is already paralyzed, the elephant cannot swallow anymore, or partially paralysis of the trunk. Then very crucial is, and absolutely important is, administration of high doses of anti-tetanus serum, 200 to 300 international units twice a day. The challenges for us, at least here in Sumatra, is that is usually not immediately available in high quantities. Yeah? And of course, there is a potential risk of an allergic shock with this, especially if you may give it intravenously. I personally haven't experienced, but that's in principle is a risk. And it's very expensive, at least here in Indonesia, it's very expensive. If you have to do a treatment over a period of 10 days with 300 international units twice a day, we have to spend about 10,000 US dollars. Yeah. Apart from that, well, there's a picture of the anti-tetanus serum. If we can identify the wound, which is the source of the tetanus infection, of course, antiseptic and surgical wound management, but that's not always the case. It can also be an internal wound, like a gastrointestinal ulcer or something that is the source of the infection. Treatment with a high dose of antibiotics. And then as the elephant cannot swallow anymore, of course, we have to substitute fluid intravenously, and intravenously we usually don't achieve enough to maintain the elephant, which is not able to drink now for a longer time. So also additional rectal fluids, and also forced feeding with a stomach tube can be indicated if the elephant is unable to swallow for several days or weeks, or sometimes even up to 2 months in the longest case that we have handled. Yeah, you can also do a sedation with the elephant to keep it calm in a quiet environment, and sometimes recommended is do slinging. But in my experience, if the elephant is collapsing, then it's anyway too late, because then your initiation of the anti-tetanus serum treatment has started too late, and the elephant will painfully die anyway. And in my opinion, then it is better to euthanize an animal. So to prevent that, we do in all the elephants that we are involved in the captive elephants, we do annual tetanus vaccinations, for which different papers are available that recommend 1 to a double horse dose in elephants, producing sufficient titers. Unfortunately, here in Indonesia, the tetanus toxoid vaccine specifically for horses is normally not available. There is no importer that makes it available regularly in Indonesia. So we have started to use several years ago already human vaccines, which are available from a company in Indonesia, which is also seen as available in other Southeast Asian countries. If it's the first vaccination, then this vaccination should be or needs to be repeated after 4 to 6 weeks after the first vaccination, after the first dose, and then is followed by a single dose once a year in each individual. So we use 5 milliliters. So the human dose of this vaccine is 0.5 ml. So we use 10 times the human dose. We haven't done an evaluation of the titers using this one, only with the horse vaccine. But since we're using that so far, at least we haven't had any cases in the population that we are involved in. So apart from captive elephants, we also get involved more or less regular in wild elephant situations, treatment of rescued and injured elephants, translocation of elephants, fitting GPS collars, and postmortems. So different kind of injuries in wild elephants which we try to treat in the wild, like a huge wound as a result from a gunshot wound, miasis in a wound on the vulva. I think this is an elephant. This was an elephant that has climbed several times over a barbed wire to get into the farmland of a local community and had an infected wound with miasis on the lower back. And there's an elephant that has been stabbed by spear trap, which is a very nasty part of a elephant trap that is used in has been used in some parts of North Sumatra. And of course, snare wounds. I think most people that work with wildlife know snare wounds. We also find that in the elephants, of course. If possible, we treat the elephants in the wild and let them go directly, but in some cases we have to take them into captivity to continue the care properly. Translocation of wild elephants, of course, is a very controversial issue. Nevertheless, sometimes the conservation agencies decide to do that because there are individuals or very small group which are isolated in farmland and are threatened to be killed, poisoned, or shot by the farmers. And then, of course, we also have to support or fitting GPS collars for wild elephant monitoring, for human-elephant conflict migration, and to understand the migration routes. We are involved in these operations. All of these operations, as you can easily imagine, require sedation or anesthesia, some form of anesthesia or sedation. In Indonesia, the tranquilizers or sedatives which are available are limited. 10% psilocin, 10% ketamine are usually always available. Solitol 50 and a low percentage, 2% psilocin and 0.1% medetim is available. However, these two drugs are not very suitable for elephants because the concentration is very low. That means we will need high volumes, which are too big to put in a dart. But so far, psilocin-ketamine combinations have been proven to be sufficient for reliable standing sedations in wild and captive Sumatran elephants for different needs. And we also sometimes have high concentrated medetomidine, 30 to 40 milligram per milliliter, available, which is imported. And with these high concentrations, of course, we can achieve very low volumina where we can use 2 to 3 ml darts, which of course is very nice. These are the dosages of psilocin-ketamine combination, which you use in wild elephant. In captive elephants, if you use it in captive elephants, it's about 2/3 of these dosages. And often we need to top up this dose if we have to deepen the sedation, or if we have to extend the sedation. Of course, you can imagine a wild elephant, usually we don't know the weight, so we have to estimate the body weight. Once the elephants are sedated, we also measure the elephants and then recalculate what was the actual dose. That is so how we know about which dosage we are given. So you see there's a very high, relatively high range. And depending on the effect or how deep the sedation is or how long the procedure is, sometimes some 30 to 50 minutes after the initial dose, we need to give a top up, which is about 1/3 to half of the initial amount. To reverse the psilocin sedation, we use usually yohimbine, 0.05 to 0.11 milligram per kilogram body weight, depending again on the procedure, about 45 to 9 minutes after the initial administration of the tranquilizer. In cases where we have high concentrated medetomidine, we use 6 to 8 microgram of medetomidine per kilogram body weight combined with 250 to 500 milligram solitol. So this is for wild elephants because the sedative effect takes faster, is faster initiated with medetomidine, but the half-life is shorter. So in case where we have to extend or prolong the or deepen the sedation, then we use psilocin-ketamine because then we can inject it manually just by hand because the elephant is already partially sedated. Important is for the reversal of this medetomidine sedation, we have to use atipamezole. That yohimbine is not sufficiently effective, not sufficiently reversing medetomine. The atipamezole is reversing both medetomidine and psilocin. Well, Finally, just a very few words. Sometimes we also have to do postmortems in wild elephants, which always comes with a lot of challenges. As you probably can imagine, these elephants are found detected somewhere in the forest. The animals are very big. They cannot easily be removed, so you need a lot of heavy-duty equipment. Like knives, axes, saws, bolt cutters. You need a bunch of people to help you to cut the entire body apart and be able to take some samples and look inside. And of course, the entire logistical situation is often very difficult, like here in a riverbed, where you also have to watch out if it starts raining, if the river may get flooded, and not always you can get the elephant in a proper position. And of course, often also the carcass is already in decay, and the samples that you can take are limited. And also the possibility to store samples. We don't have electricity in there. We often don't have appropriate cooling facilities. So the results that you gain from these postmortems is very often not ideal and not perfect, but in each situation, you only can try what is possible with the given conditions and try to get the best result out of it for what you have done. Yeah, that a little bit in a nutshell is some things that we are working on in Sumatra and some of the experience that we have gathered in Sumatra with the work with the captive and with the wild elephants in Sumatra. I would really thank very much the organizations that support our work here in Sumatra for the elephant veterinary work, which is US Fish and Wildlife Service, the International Elephant Project, Asian Elephant Support, Durga Wildlife Fund, and Zoos Victoria. Thank you very much for your support, and I would like to thank you all for your attention. Thank you very much.
Yeah. Thank you, Dr. Christopher, for a wonderful presentation. It was very interesting and very illustrative also. Plenty of color. Let me check if there is any questions for you. I think there is one question. I will like to just read it out so that it will be recorded. Yes, there is one question from Dr. Azad Mohammed. And the question is, it's a nice presentation. I wanted to ask either you have any experience to treat an elephant in captivity with knee joint pain and swelling caused by long-standing time. Is there any specific solution or preventive measure to avoid this problem? Thank you. Yeah.
I don't have, so we have not a lot geriatric problems, often as a geriatric problem. If you have a problem like that, of course you need to try to see if there is an underlying problem. Has the elephant probably some orthopedic problems? Is there some difference in the length? Because I know that has happened not in our place, but in other place, length with one of the feet. And of course, if it is an older elephant that has chronic arthritis, then of course I think you only can do symptomatic treatment with pain medications. Another point is, of course, you have to look into the keeping condition. On what ground is the elephant kept? Is the elephant kept permanently on hard ground? Is there a possibility? Is the elephant? What is the work activities of the elephants? The daily activities? Is that something that contributes, or is it probably arthritis, age-related arthritis? Which then I don't think there is a lot of things that you can do apart from pain medication.
Thank you, Christopher. Another question is, when do we start the tetanus vaccination?
Well, we do start the tetanus vaccination. So if you have captive-born calves, if they are 8 months, 10 months, then we usually already do the first vaccination. Yeah, so below 1 year. So and with any other elephant, anytime. So if you have an adult elephant which is not in a vaccination scheme yet. Yeah, you can start anytime, of course. Yeah.
Dr. Bhaskar has a question. It's a nice presentation. Purpose of management of captive elephants in Sumatra, or patrol in forest, or tourism?
Well, the major reason, the reason why we have a captive elephant population dates back to the 80s and 90s, when the Indonesian government decided to capture elephants from the wild to reduce human-elephant conflict. Yeah, so there was not really the reason to take elephants from the wild, because there was a purpose to use the elephants for, but the Indonesian government for almost 2 decades had the policy, or had a part of the policy, for human conflict mitigation to just simply capture these elephants, which has not solved the problem, because the decline of habitat has continued. And initially there was not really a appropriate concept what to do and how to utilize these elephants. Nowadays, a good number of these elephants which has survived is distributed to zoos, safari parks within Indonesia. So you can say basically the tourism, but also more and more during the past year, there has been common to utilize elephants in different, or on the border of different protected area and wild elephant habitats, to use them to do patrols and for human-elephant conflict mitigation, monitor wild elephants and push wild elephants back from the border of the farmland, push them back into forests. So that also is used in several areas, and I'm myself involved in programs where this strategy has been implemented, or is implemented since several years. Yeah.
Okay. Dr. Ganga has a question. How common are the wildlife crimes involving elephants in Sumatra?
Relatively common. So we have basically, I would say, two levels. We have the illegal killing, just to get rid of the elephants, if the elephants are considered pests by farmers or by plantation companies, yeah, where elephants get poisoned or electrocuted, or the wildlife crime, where actually elephant poached just to gather parts, body parts, mainly ivory. Yeah, it is unfortunately also relatively common, and at least in some areas where we still have populations, the male population is quite significantly depleted due to this poaching.
Yeah, thank you so much. Dr. Ilayaraja Selvaraj has given some points about joint swelling. He's just suggesting apply DMSO plus salicylic acid ointment, orally give trypsin plus bromelain, plus ceratolipopeptidase tablets. So this is his suggestion. So you have a few more questions. Sir, good presentation. This is from Dr. Selvam. Is it necessary to do TT at the time of wound treatment?
Well, if your elephant is not vaccinated yet, I would definitely consider that. Yeah. But we need to keep in mind that if we start with a tetanus toxoid vaccination, it will take at least 10 to 12 days until there is a sufficient antibody level. So if you have a wound which you are suspicious that may develop tetanus, I would go dual. I would give anti-tetanus serum for direct protection, and then start a vaccination. Yeah, start a vaccination of them. But if you need immediate protection, then the toxoid vaccine will not help you, because that will take at least 10 to 12 days until you have a titer. So then it is better to use the anti-tetanus serum. Yeah.
Yeah. Dr. Gurudat Sharma has a question. Very informative session, sir. Which anti-helminthic drug you found most effective and safest for elephants, both for adults and calves?
Well, I can only say, and so far the ones that I have shown, whether it's albendazole, ivermectin, oxyclosanide, closantel, I haven't seen any problems in any of these antiparasitics, regardless whether it's adult elephants, old elephants, young elephants. And usually we start to deworm our elephants with an age of 6 months. Yeah. in the same scheme like the adult elephants. The only drug which I've mentioned, levamisole, where I have seen severe side effects if you accidentally overdose. So that I would be very careful with. For the others, I personally, which I have mentioned, all would consider fairly safe, and they have all a fairly wide safety margin. Yeah.
Okay, Dr. Yadraj has a question. Nice presentation. Do you regularly use any other vaccines except tetanus? What dose?
No, we don't. We don't. Not because I would definitely consider in elephants. I would definitely consider rabies vaccination, because rabies is present in here. It's also reported that it has affected elephants we don't have reports in Sumatra, but from other areas in Asia. But that is a little bit sensitive in here, because it's not our elephants. We cannot decide. We have to apply to the Central Conservation Agency, come up with a proposal, and we have that done in the past. And for rabies vaccination, that has not been permitted.
Yeah, thank you.
Because with the explanation, or with the argument that there is no specific rabies vaccine specifically for elephants, which, in my opinion, doesn't make a lot of sense, but that's what was the explanation.
Yeah, thank you. Next question. No name is not given, but he has got two questions. One, are you practicing any other vaccination protocols in elephants like FMD, HS, and BQ?
No.
Yeah.
No, for the same reasons that I just also mentioned for rabies. We have considered that, we had discussed that, but in the process to suggest that to the government authorities which are in charge for the elephants, that has not been accepted yet.
Okay. The second question is, how about using pentosan polysulfate in chronic arthritis?
Well, I don't know. I have not used it. I don't have any severe problems with that with the elephants. I think that is a question that should be forwarded to colleagues that work with a population where a lot older elephants that have a lot of more joint problems. Unfortunately, I cannot give any good answer to that. I'm sorry.
Okay. Dr. Ilayaraja has a question. Do you encounter any cutaneous filariasis in your elephants?
We do, but not very often. Not very often. We have miasis, of course, wound miasis we have, which also then we always apply ivermectin parenterally. But cutaneous miasis only in a very, very single few cases. It's not a regular. We don't see that as a regular problem in the elephants.
Okay, this may be the last question for you, Dr. Ajay from Jharkhand. It was a very nice presentation. Is any incidents of anthrax you have encountered?
None of which we have proven anthrax. Throughout the past 20 years, there were 2 or 3 cases where I not was directly involved in the postmortem and in the sampling, where I think it could have been anthrax, but there is not a proven case that we say we have proven by laboratory findings that we had anthrax. But I definitely would never dismiss it. Yeah.
Yeah, thank you, Dr. Christopher Stremme, for all the replies. I just hand over the phone to Dr. Heidi. Yeah, thank you.
Great. Thank you very much, Christopher, and thank you very much, Daniel.